Hey guys! Today we'll have a McKinsey-style case interview. The topic is healthcare. The interviewer is Tatiana, a Fless coach and an ex-McKinsey Amsterdam-based digital strategy consultant. She is fond of unicorns and she is an amazing case interview mentor. If you need her help in getting your consulting offer, go straight to the video description. There's a link to our business judgment course with her. Today, we also have a great candidate, Cathy, an MBA grad at Columbia Business School, now working in a boutique consulting firm in the healthcare space in the United States. The interview is gonna be fascinating and instructive. Enjoy.
So we have quite a not so standard client. Our client is UNICEF, so International Children's Emergency Fund. And they are very concerned with a certain disease outbreak in one of developing countries. This developing country doesn't have a great general infrastructure and doesn't have great healthcare infrastructure, what leads to quite a dire situation during pandemic. So every year in summer, 60% of people become ill. And the death rate is around 5%. But for children below 12 years old, the death rate is 40%, what is very high. So UNICEF wants to do something with that. And we have great news. We have a vaccine available. The vaccine is produced in Ireland, and we already have a partner who is willing to supply this vaccine at cost, basically $1 per dose. This partner can produce up to 8 million doses per year. UNICEF came to us with all this information. This is quite a lot of information. And the first thing that they're asking us, they want us to plan a vaccination campaign that is going to cover 90% of kids up to 12 years old in the country. The campaign should last 3 years. And the question to us right now is how we are going to plan this. What are the big building blocks that we need to consider to create a proper vaccination campaign that will cover 90% of kids up to 12 years old?
Great. So just kind of want to recap what I heard. So our client is UNICEF, an international multinational drug company. And recently they are going to, they have a vaccine they want to develop specifically for a developing country who lacks infrastructure. We are very concerned of the specifically for the children death rate, which is under 12 years old, over 40%, which is very high. And our partner is able to produce $1 per dose, and per year they can have 8 million doses. And today our task is how can we successfully launch a vaccine campaign to cover 90% of the kids and over the 3-year period.
Exactly. That's a great recap. Just one thing to keep in mind, UNICEF is a branch of the United Nations. So this is a non-profit organization and supranational organization that belongs to United Nations family. So it's not a pharmaceutical company, but an international organization. But yeah.
Okay, great. Absolutely. So it's an NGO. Great. Okay, yeah. Can I ask some clarifications before I kind of drill down the structure?
Of course.
Sure. So does our client has specific goal that they want to achieve like in the first 3 years? Is it more like a gradual process, or like, can you share a bit more of a background?
So the overall goal is having 90% of kids below 12 vaccinated in 3 years. That's the main goal. We can do it gradually if you recommend to do this gradually, or we can have phases. Just as a consultant, you can recommend anything.
Got it. Does our client UNICEF have experience in this country, or this is like their first time doing this in another place?
Yes, they have a lot of experience with vaccinations in other both developed and developing countries, but this is the first time they're doing the vaccination campaign in this particular country. They do have good relations with the government and healthcare systems, though.
Okay, great. Can I have like 2 minutes to jot down my thoughts?
Of course, yes.
Thanks. Yeah, so thank you for sharing the background of UNICEF. I'm very excited to dive into this case since I think vaccine is a very current issue on top of our heads. So in order to help UNICEF to identify how we're gonna plan the marketing campaign, I would like to look into 3 areas. Mm-hmm. So the first is education, the second is financial, and the third is operation. So in my first category, education, by education, I mean that how can we successfully communicate this successful marketing campaign. So by that, I think we will need some support from, first of all, like the government, mm-hmm. the healthcare organization, and also the teachers or the caregivers in the country. So by that, I mean, I think the most important part in the education is trying to identify who are the influencers in helping that could be the critical person to ensure that we can those kids can get the vaccine they needed. Understand this is a developing country, so the awareness, the importance of vaccines could not be so accepted. So I think focus on education, that would be the first critical part. The second, I think, in order to make sure, one of the key marketing metrics is the financial part. Like how much we're going to spend over the first 3 years. Understand that currently we are having $1 spent per dose, but that is like just the cost for developing. What are the shipping costs? And what is the other, maybe the manpower, like the doctors, the nurses, the physicians. Those are all variable costs we have to build in mind. So I think understanding how we can have sustainable cash flow throughout the 3 years and some unexpected spend, we have to have that financial number in mind. The third, I would say, is the operation. So understand from the prompt that this country lacks infrastructure. And this is key because as we know that vaccines needs to be stored generally under 2 to 8 degrees. This needs cold chain. So I think first of all, we have to make sure that we have the delivery system, those cool packaging, and not only when it's delivery, how about like the inventory? We also need to ensure quality insurance. To make sure those could be still in good quality in those countries. And when I say about operations, something very important is also about the timeline. So from my experience, vaccines need specifically quarantine time for the government to do inspections. So that also layers in for my first bracket about the education, like the support we need from government. Like we also make sure we have that in our operation, those standard operation process to build in mind, so that the team, the support, that operation component will also be very important. So just to recap, education, financial, and operation. Mm-hmm. So the first thing I might start will be the education but I would take a pause here and see if you have any feedback.
Thank you so much. First of all, this is a very good structure. So it's extremely logical and it covers multiple things. And everything that I'm going to say now is about taking it from good to great. And yes, this is already an excellent structure on its own. So you're absolutely rightly pointed out that education and communication are going to be a major problem for any kind of vaccination campaign. And you decided to split it in by stakeholder. Yes, we can address government, we can address a government-supported system like public sector, education, and healthcare. And that's actually a great way to do this, because this sectors, they're covering children. Yes, and we're talking here about children. And teachers are people with access to kids. Another entity that might help is business.
Yeah.
Yes, because again, you rightly pointed out that transportation might be a problem. And also, we don't really know whether education and healthcare are widespread enough in the country to cover all the small villages. Yes, we need to vaccinate 90% of kids. This means that we basically need to reach out to everyone. So we probably will need some business partners, at least from, like advisory consulting role point of view, so they can help us to reach out to people. Another excellent example can be post services, but this is more for brainstorming later. In terms of finances, again, great structure, storage, delivery are definitely going to be a question. Another thing to consider here is administration. Yes, you mentioned the manpower itself, but we also need to organize the place, materials, equipment to do the vaccinations. We haven't discussed how exactly the vaccination is going to be administered, but this all will require certain setup that is not necessarily at place right now. Yeah, and if there is no hospital in a village, you need to create a place where you can do a safe vaccination. And this I actually covered. Yes. This goes to both operations. Yes, you need to create administration, and this also goes to finances. You need to pay for them. Yes, and in terms of education, another angle you can take, there are actually two parties that we can educate. First, this is people who are receiving vaccination. And second, this is actually doctors, because medical professionals within this country, are not necessarily aware of the vaccination. This is something completely new to them, and they need education as well. But again, you have a very sound structure that is going to cover probably 90% of what we should discuss. You have all the key elements in place. So that's a great start. Let's move then to some financial questions.
Sure.
So another question that we need to assess is how much money do we need to budget for paying for vaccines? Basically, how much money we are going to transfer to our partner who is producing vaccines. This is not about transportation. This is just for the vaccines. How would you approach this question?
So understand that they are going to spend $1 per dose, right?
Yes.
Yeah. So that is only the cost for manufacturing. Do we need to consider other things like the setup cost, the labor, that is all included, right? So if that's the case, we need to figure out, we have 8 million doses, the quantity, and the number per dollar, the cost per dose. So that is in just simple term, that will be using 8 million times $1. That is $8 million for the total vaccines cost.
Yes.
Yes, and so we don't need to consider if that is already including all the manufacturing, the dose itself. Then we also, but what do that provider also do, other than the vaccine itself?
So they are producing the vaccine themselves, and you rightly pointed out that 8 million vaccines, $1 per vaccine. Yeah, 8 million per year, 24 million altogether in 3 years. But this is the supply chain of thing, supply side of thing.
Okay.
We haven't discussed yet demand side of thing.
Oh, okay, great. Okay, that's the supply side. And the demand side, when you say demand, it is like the number of vaccine needed from the country.
Yeah.
Great. So we know that we need to cover 90% of the kids. Do we have the population, like the total population? So I wanted to know, if 8 million is sufficient for us.
That's a great question. So we have 80 million of people, and out of these 80 million, 30% of those people are kids below 12.
Great. So if the total population is 80 million, we can times 30% to get 20, or so that will give us a number of like 24 million of kids under 12. Okay, 24 million of kids under 12. And I'm not sure if I'm missing something, but 8 million is just 1/3 of 24 million. So are we assuming, I'm assuming, 24, let me go back to like the children population. I haven't finished calculating into like 90%. So that will be, if 90% of 24 million will be 21.6 mil, around 21.6 million. That is our target over the 3 years.
Yes.
And so that's interesting. Are we 8 million per 8 million doses? Is that like the total capacity our vendor can produce in 1 year?
In 1 year, yes. In 1 year, yes.
Okay, in 1 year. So that means that we need around like 3. That can meet our target of around 3 years in covering 21.6 million kids.
Yes, you have asked an excellent question around what are you missing. If you think about your COVID vaccination, how many doses did you need to get the full vaccination?
Oh, great. So we are, how many doses, including like the booster shot, we took like 3 shots like in total. So how many doses are those do those kids need to take to be effective?
Yeah, let's take 2.
Okay, let's take 2. Do they have to, like, can we assume that they take it in the same year or? Okay, great. So 21.6 million children, and if we just multiply by 2 doses, that gives us we need 43.2 million doses over a span of 3 years. And that seems to me that 8 million doses per year for the production might not be sufficient for us to meet this goal.
So what do you think can be done in this case?
There are several ways, like we can negotiate with the vaccine producer. Can they increase their capacity to produce more? If they need to like increase their work shift or recruit more temporary like workers to do that, or they have to like rent another plant, those are all opportunities. But I'm assuming that they will come back to a higher cost. Or there can be 2 scenarios we can think that, either that they are putting the additional cost to us, so that might cost our per dose cost to increase. Another is that they might be able to achieve a greater economic of scale, so their price might go down. So that's 2 parts we can dig into.
Yeah, this does make sense. And what happens if our producer, if our partner cannot produce enough vaccines?
If they cannot produce enough vaccines, that means first of all, we have to find another partner. That could be one. Yeah. And another is to, if we can, like sourcing another partner could be one, like if this partner is not. And is there a way we can find more like efficient vaccines that only need like one shot? Like for example, we know that J&J at that time they say you only need one, although now there are other like discussions around that, but we can find more effective doses.
Yeah, that's
one point. Yeah, more effective doses. And also think about that is from like the number of like meeting the supply side. The demand side, like if we can only have that constraint of 8 million, I would also think about who are the most vulnerable ones. Who should we prioritize? Like for example, when we're rolling out the vaccine in the States, we started from the more elderly population. So it's also worth looking into for those under 12. Like, is it more in the infant period, or is it like more towards a teenager? Who are the most vulnerable? So that's two ways I can think about tackling the supply demand part.
Yeah, this all totally makes sense. This is a great approach, and we managed to find another partner.
Great.
The trick with this partner is that they want to make profit on that. So their vaccines are 10% more expensive. So what would be the final budget for vaccine purchase?
Right. So it's like over the 3 years, they can produce like any capacity we need, but just like 1.1, 10% of increase of $1 is 1.1. So what I'm thinking here is use the total number of vaccines we needed is like 23.2 million doses. I will first take out 24 million because that is like a fixed cost, not fixed cost, it's like the sheer cost that our first vendor is willing to do. So with that, I will set aside 24 million doses. And so the second provider needs to help us to produce 19.2 million doses. So how I came up with that number is just 43.2 minus 24. So with 19.2 million doses, I'm gonna further multiply that by just $1.1. Is that okay with you?
Yeah, absolutely.
Okay. Would you mind me like rounding out numbers, or you want like very specifics?
You can round up numbers.
Okay, yeah. So I will just use maybe around like 20 million times like 1.1. That maybe gives us around like $21 million. Does that sound right to you?
Yes, sounds about right.
So with that in mind, 24 plus 21 million from those two providers is around $45 million that we need to spend for the vaccines cost itself.
Yes.
Right.
Correct.
45 million. Okay, great. So that is just the cost for the vaccine itself. But I'm sure that when we talk about marketing campaign, a lot of that will also include like, distribution costs, education. Those we need to make sure our marketing effort is effective. Yeah.
So as you started to talk about marketing campaign, what do you think are the media that we can use to inform population? Or what are the channels that we can use to inform population?
Can I take like 1 minute to jot down my thought?
Thanks. Of course. Yes.
Great. So when we think about like the media for marketing, like the channels, I will specifically split into two categories. So one is the government, and the second is the community. So in the government, I will think about the different stakeholders and like the locations. So first is like the public health. So that will be like hospitals or even clinics. I think they are the main person for driving the campaign. Like they are the one that have to create like posters or like educational like white papers for those for education purpose. And then those can be further distributed to like schools or the local clinics where people will go, so that teachers, doctors, they can like have those information and really tell the children, like the 0 to 12, oh, it's important, like for them to think that, oh, it is very important to get vaccine. It is like cool to get vaccine. It's new to them. But I think like having that discussion from like a top-down approach, that will be important from the government sector. So the other part, the other quarter is the community. This is more from like a bottom up. When I say bottom up, is to kind of identify who are the influencers in this community. So in a developing country, my thinking is that my assumption is that like start from like the religious place they go, like every Sunday, maybe like church. Like church, like they can start there from talking about it, sharing their experience, and or like childcare centers, and like for them to talk about, okay, why is this important? And I also classify like companies and business in the community part, because like, yeah, those are also like parents. So like having those like healthcare educators, nurses to go to those places to host like a lunch and learn, and or like some educational like conference sharing. Those are all great opportunity to start from a more bottom-up approach. So I would say that from the public and the community sectors, those are all great channels where we can start.
Yeah, this does make sense. Are you planning to use anything from, traditionally perceived media channels like TV, radio, internet, mobile?
Oh, okay. Yeah, those are also great points. Yeah. So I assume that this is more of a developing country. And so it would maybe tailor toward more of a traditional like newspapers or like just posters, but definitely like, yeah, TVs, news, and even I think, yeah, internet definitely is like, we can start from more of the people who have access to internet. They can start to be the early adopters we can identify. So yeah, great point. Like those both traditional media, offline, online, we should definitely utilize them. Yeah.
Yeah. So taking into account that this is a developing country, so person-to-person communication cannot be underestimated. But in terms of traditional media, how would you decide what is the most appropriate?
How would I decide what is the most appropriate? I would start from the date where our targets. I will think from where our targets go day to day. For example, if we are targeting a parent, moms, I will think about when they start leaving their house, where do they go? For example, developing country, assume she needs to take the bus to work. So maybe like a bus, a poster on the bus, like those. Those could be a good start. And I assume if she doesn't have a mobile phone, maybe she can pick up a local newspaper. So those media channels, those could still be very effective. Yeah. So maybe when she go to work, there's like a local newspaper, and I would also think about in the like the HR, like the central service of those big companies, assuming she works as a factory, those people could also be important stakeholders that we could reach out to. Yeah, so that's from a caregiver perspective. And if it's more like thinking about the child itself who's going to take the vaccine, the easiest way is to start approaching from the teachers, the nurses in the school. Those are all good channels, like good, I wouldn't say word of mouth, but like the influencers that could affect the children. Yeah.
Yeah, this totally makes sense. This is actually a very good outline of what can be done, and probably the face-to-face or person-to-person communication would be the key here. Though it cannot be used, for for the whole country communication. So you will need layers. Yes, you will need some formal channels to communicate it to the local layer, and local layer probably will go face to face. So talking about your structure in government and communal resources, that's a very nice approach. Also because it helps to identify who can take responsibility of all that. And another player that you haven't mentioned, but I would bring in, is nonprofits and other organizations that are in the area, because people tend to trust them a bit more than the government. And there is always the question of how much do you trust the government? I'm Russian. We don't always trust the government. Yes, in terms of media. So when you're asking a question, how would you choose? You usually need to come up with a criteria. So you gave a very nice answer. But if you want to address criteria, yes, how many people are facing these channels of communications? What is the feasibility? What is the price? Yes, what is the view per dollar, if I may say, which is not the entirely correct metric here. But yes, first of all, we need the channels that people are facing, and this is actually, we have a lot of assumptions about what is happening in a particular developing country. Also because I haven't named the country, so this is double hard for you. But usually anything that requires centralized infrastructure is not there. So things like TV and stationary phones typically are not working. But things that are relying on business and distributed networks, they might work. So in many countries, a mobile internet and mobile connection is available, and you can use SMS or you can use messages. They literally can have one phone per village, because sometimes they need to call a midwife or a doctor. And then, yes, you will send a message and people can see it. So these channels, this is something you can use as well. But I would repeat, you gave quite a nice answer that shows what can be done. And you gave it in a very structured manner. We have the last thing to close, actually. So summary, just a standard situation. We have a steer core and 1 minute to present. So what would you say to the head of UNICEF?
Okay, 1 minute. Okay, can I take 1 minute to jot down my thoughts?
Of course, yes.
Yeah, so in order to help our client at UNICEF to ensure a successful marketing launch campaign in this developing country, I'll recommend we do the following 3 points. The first is to ensure we have enough budget of 45 million, since we have to ensure covering nearly 21 doses over 3 years. And the second is that make sure we have enough distribution network, the operations to coverage the operation need in this country. And the third is to identify the right media channel for us to send out our educational campaign efforts to make sure that we get that message across to the important key stakeholders. Well, some of the risk I foresee is that we won't have enough support from whether the government, or we don't have trust from the local community, as we are coming from an international perspective. So the next step I would recommend is first of all is to find the right partners that can help us to successfully do the operation things in the country. And the second is to make sure we can find who are the key influencers in the community for us to build trust. Thank you.
That's fantastic. That's a very nice and to the point summary. You can also repeat the goal.
Okay. Yeah.
Just in case. Yes.
Yeah, you're right.
People on Steerco, they don't always know what was the goal of the project. Speaking from experience.
Yeah, cover 90% of the children under 12 years old. Yes, you're right.
Good. Fantastic. So what do you think about the case?
I think it is an interesting case. So I didn't expect it as like nonprofit, but as soon as I was aware of nonprofit, I knew that profitability will not be in the discussion. So that's why, like in my recommendation, I just mentioned we have just enough budget. Yeah. And the second is like more about the operation. And the third thing I think is like, it's also remembering that you have to be coachable along the way. So kind of give me feedback that, okay, the trust layer. So I kind of echo that. Yeah. Reminding me trust. So I just intentionally put that in my recommendation to kind of make you feel that I did remember what you said was important. Yeah.
Yeah, that was absolutely wonderful. Yes, in general, that was a very good solution of this case, because this case can last forever. But yes, and you started very well. You asked the right questions. It's always good to recap who are those people, what are they doing, what their business model is, if you're talking about a normal business case. It's always good to double check what is the goal of them. You did exactly that. Your structure was quite good. So you had a very nice exclusive structure. Yes, you had several buckets with different issues inside. There are some things that you can add to populate it a bit more and make it more exhaustive. Yes. So maybe you can double check your structure when you draw it. Just can you think about something that doesn't fit there yet? Yes. So adding business, adding medical professionals. But yeah, your structure actually is good enough to go through the case completely. So that's great. That's amazing. You did quite well with the calculations. Yes. When we calculate a market, or we calculate, when we calculate the market, this is basically the market. Yes, the market for vaccines. You always have the supply part and demand part, and they do not necessarily match. Yes, usually people in this case, they calculate how many vaccines are needed, but they forget that the supplier can produce only 8 million vaccines per year. So, and you didn't do that. You caught that there are some capacity restrictions. That's always nice. And when you calculate, you always can round up. And this, in cases like this, you can always say that I'm adding, 5 million vaccines on top because we need to transport them, and this is our safety stock. So this is something.
That's a great point. Yeah, that's a great point. Yeah. Yeah. Like defective quality issues. Yeah.
Yeah. And so your idea generation was good. So nice, very nice structure. And you thought about who is going to implement it. Yes, because you can come up with whatever wonderful ideas. If you don't have hands and responsible people to implement this, nothing is going to move forward. So this is one of the ways you can do it, definitely. And yes, you can talk. I mentioned traditional media because this is how I usually check this case. Yeah, that was nice. And again, we see the same question of keeping it exhaustive. This is always very hard because, you give a very, you have a very structured approach, and it is very easy to follow, actually. So this is great for the interview. And yes, but it's hard to remember all the small things that should go in place to exhaust this place completely. Can see. And your summary that's a good recap of a case. You can always add the goal. And you also mentioned the next steps for the client, which is always great because during the meeting, consultant's goal is to leave without to-dos. And the way to do it is to give to-dos to the client. So good job. Great job.
Thank you. Is there areas of improvement like you would suggest me to do to ensure for getting to the next level? Yeah.
I think you can work on making instructions exhaustive.
Okay.
And in calculations, more practice is not going to hurt. You are calculating again in a very logical way, easy to follow, but it's visible that you're thinking. So it's visible that in your head you're trying to figure out the way to go through that. Just a bit more practice wouldn't hurt to make you feel confident and look confident during the interviews. Yeah, I don't think there is a real problem behind that. So this is
okay. Look confident when you're calculating math. That's a great point. Yeah, thank you so much. Yeah.
Good. Yes. Yeah, I hope it was helpful.
It was helpful. Would it be possible for you to share the solution to me? Like, is there like a solution case or something? Yeah.
I can share the way I approach this case.
Yeah. That would be good.
Yes.
Yeah.
So that's a good suggestion. I actually have a different structure to approach this case because I usually go from using the value chain method. The first one, several blocks. First block is production. Second block is transportation to country. Third block is transportation within the country and what we call the last mile. Why I'm splitting the two in the two different blocks? Because transportation by sea or by plane is usually a very straightforward thing. You just hire somebody and they do it. There are risks involved, but you can mitigate them. But last mile is usually the headache. Yes, and in this case, if we would have dived in more in supply chain, I would have told you that 80% of population is living in villages, only 20% are urbanized. There are no healthcare facilities in smaller villages. How you're going to bring people to the vaccine, or are you planning to bring vaccines to people? So this is something that can be discussed as well. So I'm splitting usual transportation from country to country and the last mile. Then I have vaccine administration, and then we have follow-up, basically tracking whether vaccine was effective and how people feel after the vaccine. And in supply chain, as always, you have these 5 blocks, but you also have the arrows that run through everything with finance. I think finance and communications are the main things there. So this is my excellent structure. I have, yes, like this. I have terrible handwriting.
Okay, finance and communication. Okay, great.
Yes. But yeah, first you need to produce, then you need to transport to the country and within the country. Then you need to administer, and then you need to follow up. Doing all that, you need to arrange financing and operations for all the 5 steps, and you need to run communications. And communications, you already need to start at the production phase, because otherwise, when the vaccine is in the country, there are no people coming to get the vaccine. And that's a terrible situation. Yeah. Calculation, this is your solution. So that's absolutely the same solution. As for the brainstorming part, I usually split this in different types of media. So this is typical: TV, radio, printed media, internet, mobile, and word of mouth. And giving a couple of examples for each one. or rather discussing what are the benefits and drawbacks of each one. Yes, because TV, probably not many people have access to television and the infrastructure might not be there. We can run advertisement, but we cannot guarantee that this is going to be effective. Radio, actually, it might be working, but again, you need people to have a device, you need people to have a radio and actually be near the radio where the message is transmitted. So this is not a great channel for the message. Printed media is amazing if everyone knows how to read. There were cases in the industry where they made cartoons and distributed cartoons. But printed media also need to reach people. You need to leverage post and you need to leverage trade. Yes, because there are people delivering food and goods to the villages and you can send your printed media with these people. Internet, great tool if it's available to people. And very cheap as well, nice to go to. Mobile, great as well. Also because you are receiving the message and you can time the message. And if you need to have an exact break between two vaccines, you can send one message and you can send another message as a reminder to a particular person or into a particular village, assuming that they received vaccination approximately at the same time. And the word of mouth, this is exactly what you said. This is crucial to make the campaign work. People typically trust people, not government or other entities, and especially not UNICEF, who is coming from nowhere. So you need to have support of local communities. You need support of teachers. You need support of postmen. You need support of midwives who probably know women and women have children. Yes, religious leaders, non-profit leaders, everyone from this point of view. Everyone who can help is welcome to help, as usual, in this kind of situation.
Thanks for watching this case interview. If you have any questions, please feel free to ask in the comments below. Like, subscribe, and come back soon. Cheers!